Many active duty military and veterans get mental health treatment from civilian providers. That's just one reason the local nonprofit Psych Armor Institute offers training and a hotline to non-military mental health workers. Founder and CEO of the Institute, Marjorie Morrison, and VA San Diego psychologist Carrie Rogers. Welcome to Evening Edition.
Thank you.
Now, Carrie, how many military members or veterans actually seek mental health care outside of the VA healthcare system?
Well, we know that about 40% of eligible OEF, OIF, so Iraq and Afghanistan conflict veterans seek care outside of the VA for any kind of care. Around 80%, 85% seek mental health care outside of the VA.
And those are some of the same numbers that you also cited for doing this project. So Marjorie, why do you think that people go outside of the VA healthcare system to get help?
Well, so just to clarify, what I would say is 85% of providers that are providing that support to the military and veterans are non-attached, they're civilian providers. Mm-hmm. And I think that they're going for a lot of different reasons. For one is that if you're active duty, there's still that fear that it might affect your career. There might be some shame involved. And as far as the VA, you know, some people do really, really well there and other people don't, and they want more anonymity.
Anonymity, right. And Carrie, do you think there's other reason? Are there long wait times? Is it hard to get into the system?
You know, we're working hard on the wait time issue, but part of what happens as well is that not all veterans are close to a VA. There are a lot of rural veterans in this country who prefer to see providers who live closer to their homes. Some veterans and military members don't want to see their health care in a large system and find smaller clinics easier to navigate for them. So that's a reason as well that people seek care outside of the VA.
Yeah, let's talk about one in particular, post-traumatic stress disorder, or PTSD. We hear a whole lot about that. Would you give us the scope of what that's like right now in the VA healthcare system?
In the VA healthcare system, we are estimating that overall there are about 250,000 veterans, OEF, OIF veterans in the VA healthcare system that have a diagnosis of PTSD.
And how many people here in San Diego do you see that either have PTSD or other mental health issues?
You know, about 25% of the veterans that are enrolled at the VA San Diego have a diagnosis, who seek mental health care from us, have a diagnosis of PTSD. About 40% have some sort of mental health condition.
So I heard a number that there are 4,000 mental health visits, not necessarily just at the VA though, right?
There are, in the VA San Diego healthcare system, we have about 3,800 contacts with veterans for mental health conditions each week.
So it's a large amount of people that are trying to seek these services. And Marjorie, when you first started treating members of the military in your practice, you've said that you didn't necessarily understand all the intricacies that you needed to. Give us an example of what you needed to know.
Oh gosh, I mean, it's so different. It's such a completely different culture. And part of it is that I think most civilians would agree that we don't understand the military culture because it's somewhat insular, right? They go to schools together, they have their own shopping centers together, even their own rec centers, the kids hang out together. So it's not even just understanding the job, it's understanding the way of life. It's understanding the difference of enlisted and officer. It's understanding the different ranks and what they mean. It's understanding the mission and putting the mission first. It's something we're very focused as civilians on us becoming better people. They're very focused on the unit.
And Carrie, would you add to that? There's something particular about the military culture that you think maybe civilian therapists need to understand?
I think all of those are excellent points. You know, one of the things that we see a lot is stress just from deployment or stress from mobility. Military members often move every 2 to 4 years, something that civilians are not always thinking about and aren't aware of. So those stressors can be very different for military and veteran families.
Okay, and Marjorie, your institute, I should say, received that $1 million grant from San Diego philanthropist Becky Moores. How specifically are you going to spend that money? How are you going to help healthcare workers improve treatment?
You know, what happened was, as we went out and we started going out to the communities around the country and training providers, we found that learning in class, it's just like any class you take, you remember, but what's your retention 6 months down the road? That this need for ongoing support was so desperate. We're losing lives. Suicide rates are through the roof. PTSD are issues, homelessness, unemployment, and there's no, people go get help, and the help doesn't have any place to access support, resources, referrals. And so we just knew that there was this need to create an umbrella for all military mental health care. So that grant is going to be used towards building out the hotline, which is a national hotline free for all providers, and in building out an online portal, like a chat room for people to share stories, share communities, build out webinars. We're looking to be the umbrella of military mental health.
And Carrie, in addition to that, what is the VA doing to bridge services for the military here as far as mental health care?
In San Diego, one of the things we're doing through the VA Center of Excellence for Stress and Mental Health is we go out and train providers in the best evidence-based care that's available for depression, for post-traumatic stress disorder, and we also offer consultation to those providers once they have received that treatment so that they can use those therapies, which are really gold standard therapies when they're working with active duty and military veterans.
All right, well, we have a lot more about this on our website, kpbs.org. Carrie Rogers and Marjorie Morrison, thank you so much.
Thanks for having us.